you're losing a part of you.
In 2016, Rodneyse Bichotte lost her son after going into labor at 22 weeks. The New York State Assemblywoman was denied treatment by the hospital. They cited a policy that says they can't intervene that early in a pregnancy because of insurance.
And I looked at them with horror. I'm like, how insensitive can you be? I said, I want to try to save this baby.
The Brooklyn Democrat gave birth to her son at another medical center, but hours later he passed away. She says if she had been treated right away, it might have been different.
It was probably the most, devastating moment.
The lawmaker is certain race played a role in how her case was handled. CDC statistics show black infants are twice as likely to die than white infants, and that preterm birth is 50% higher for women of color. Recently, doctors and health professionals have pointed to a variety of factors that could explain the differences. One of them is racial bias.
The level of respect varies according to your gender or your race.
Longtime nurse ALECIA Jones believes some of that is because of the way black women are treated by medical professionals.
If you are not a woman of color and you advocate and you ask questions, you are listened to, where if you're a woman of color, it's just dismissed and you have an attitude.
ALECIA runs New Beginning Center of Hope, a pregnancy resource center in Jamaica, Queens. They place an emphasis on making sure women don't feel any bias when they walk through the door, something she has personally felt.
And I've had really good practitioners that treat everybody the same. But I've also had practitioners that once they their implicit bias really shows.
Assemblywoman Bichotte is working to end racial disparities in maternal health care. She's currently waiting for a bill she wrote, named the Jonah Bichotte Cowan Law after her late son, to be signed into law by Governor Andrew Cuomo. It'll require hospitals to tell pregnant women if they're going into preterm labor and force them to provide care if it's a high-risk pregnancy, things that would have helped her. Joan TROPNAS is the director of the Health and Human Services program at St. John's University. She says while laws are important, so is education, so that people are aware of the biases.
But if we are aware of them, then we can work to diminish them.
Joan says black women are often prejudged when they walk into a medical office. It's something that has to change so that maternal care can improve. In Windsor Terrace, Brooklyn, Emily DROOBY, Currents News. If you're watching Currents News on YouTube, be sure to hit the subscribe button and then click on the bell to get instant updates about all of our newest content, because we are putting your faith in the news.